President Trump signed an executive order Monday laying out a number of new recommendations for childhood vaccines. The White House is calling the order a victory for parents' rights, but many members of the medical community are calling the revamped guidelines confusing and potentially dangerous. Jesse Mitchell has more.
President Trump's executive order reduces the number of universally recommended childhood vaccines from 18 to 11.
This announcement is a major victory for parents' rights, for religious and constitutional rights, and for the gold standard science.
The order also advises states separate the measles, mumps, and rubella vaccine into 3 different single disease shots and recommends administering the immunizations at separate appointments when possible.
For example, at 1 year, you should have 5 separate visits for vaccines rather than getting them all in the same day.
During his remarks, the president suggested a link between the number and timing of vaccines and increased levels of autism.
Decades ago, children received only a small fraction of the vaccines required today. In those times, people were much healthier, and of course, the high rates of autism now observed did not exist.
But in tests conducted for decades across multiple countries and on more than 1 million children, there's been no evidence the existing childhood vaccine schedule poses long-term risk to children's health nor increased risk for autism. Numerous medical organizations have expressed concern over the new guidelines.
The executive order that was issued today is going to cause more confusion and fear.
Why would we do less and not give the vaccine at once when we know it's safe and it works? The downside of a recommendation to split them is that it'll make people fearful so that they won't get the vaccine at all.
Also expressing concern, Republican Senator Bill Cassidy of Louisiana, who is a doctor. He urged parents to follow advice from their family pediatrician rather than listening to what he calls an inaccurate executive order. Jesse Mitchell, CBS News, New York.